Hello, I'm Michael Mallinson. I'm interviewing here for the Arthritis Broadcast Network, and our guest this evening is Ken Gagnon of the Arthritis Society Quebec Division. Good evening, Ken.
Good evening.
Would you like to tell us a little bit about your role at the Arthritis Society in Quebec to begin with?
Yeah, I'm acting as interim lead for the division, so I'm in charge of the division at the moment. I used to be head of the educational team and then head of advocacy and relationship with the ecosystem. So, and now with the new possibilities, I just take on the executive direction of the division.
Congratulations on that.
Thanks.
I can imagine it's a lot more work. First of all, I've had the pleasure of attending a couple of the Quebec congresses that the Arthritis Society has held in October. I was out of country this past October, so I missed it. But tell me, how did it go compared to the others?
It went really well. In fact, we were in 8 locations throughout the Quebec. The main event was in Montreal, all over the place with the live stream that we've got, and also the person attending all the various satellite that we had. We had over 1,200 participants that went there, covering a lot of topic. In fact, we were having over 20 topics that were discussed about how to better live with arthritis. What is the disease? What are the comorbidities toward it? And what are hint of solution of how to better manage your disease and your daily living with it?
Yeah, thank you. And how does the Arthritis Society match patient needs and requirements with the support that they need and the advocacy that they need? Tell me about how the Arthritis Society handles that aspect, how it listens to patients and how it advocates on their behalf.
So over the past few years, we have done a lot of advocacy for the patient. As a matter of fact, one of the patients have come to us and tell us that she wasn't a lawyer. She's got a good salary, and she was able to pay for allied care professionals. Although her cousin was in a daycare facility, and most of the time she was working from home, and she had to downsize her workload because she wasn't able to manage her disease and be able to have access to those resources that she would have liked to have to be able to better manage her disease. So she came to us and asked us, could we do something toward this? A bit as what is done with the Mary Pack Center in the BC, having access to OT, PT, social worker, and so on. And the same that is done also with the Ontario, with the AREP program. So we did take her question with higher stake, and we went to the government asking them what could be solution. Could we truly assess what is the need in Quebec? And then starting from there, speaking with various deputies and so on, and with rheumatologists, with patients, we have come to a realization that if we want to get some traction, we have to do our own study. And we did a socio-economical study to address what is the burden of arthritis for the indirect costs. So presenteeism, absenteeism, a bit as the AAC have done, but what are the specific for the Quebec population? Then we took those and we assessed throughout all of Canadian background, but elsewhere in the world, what could be solution that could we bring to the government saying, you want to address this is a dire need, it costs a lot to the Quebec environment. Let's say it's costing 4.3 billion every year. And how can we mitigate those costs? And then starting from there, we have said that based on what is done elsewhere, we must increase in primary care setting access to OT, to PT, to social worker, to help to help the patient better manage their disease and be empowered to be their own self-advocate and taking more in charge their own disease and be empowered to better live with this devastating condition.
Yeah, you mentioned, excuse me, you mentioned comorbidities before, and it's quite evident that most people do live with a number of comorbidities, and therefore you have to take a holistic view of their health and bring in all those providers. But I understand there's been a change in at the ministerial level in Quebec. So how do you build and continue relationships when you're advocating for patients in front of the government?
It's hard because we are in a never-changing cycle. Every 4 years, we have to manage new ministers that have been appointed. Some bring new changes to the ministry level, appoint new deputies. So how can we better get some traction? For sure, we got to have strong relationship with every stakeholder in the ecosystem. We have started to have great relationship with the rheumatologist, with the patient first. Mm-hmm. So we've got some great advocates working for us, echoing our messages, then bringing on board other associations, the Physio Association, the OT Association, social worker, the GPs. Then we're going to see the ministry itself, mm-hmm. the Innovative Bureau, and then I'll bring all this ecosystem toward a solution that can help arthritis patients, but also maybe could help other patients mm-hmm. with chronic pain or chronic disease. So we're going to see the Chronic Pain Association and start to build up the ecosystem. And then once this ecosystem is strongly built, it is easier to go knock back at the door and engage them once more. And that's what we have done over fall. When there was this election, we have asked every patient organization, mm-hmm. every patient itself, and every other association to send letter to their candidate and to the chief of every parties. And as a matter of fact, the CAC answered that yes, we want to hear more about it. So mm-hmm. when they have won the election, we went back to them and asked them, would you like to come to your to what you have engaged to be able to speak to us and address this issue? And we got a great hearing from them. And since they want to deliver more care at a primary care setting, it was making total sense for them to investigate more on this. So we're coming to get some new traction, and they want to see us in a few weeks from now. So hopefully it will unfold to a better access to those allied care professionals.
I think that's great that they're willing to talk to you, and in fact they're willing to listen as well. Just changing topics a little bit, how autonomous is the Quebec division of the Arthritis Society? Can it do things differently than divisions elsewhere in the country? Are there differences between the types of services that they deliver?
We're a national organization, and for this we've got core program that we're delivering throughout Canada. Although advocacy and some particular issue are provincial jurisdiction, so the principal issue that we're facing here might not be the same in BC, might not be the same in prairies, might not be the same in the Atlantic. So for advocacy purposes or for dire need that address our specific population, yes, we have the breathing room to be able to address those as we wish to, mm-hmm. but always in this mindfulness that we are a national organization and we have priorities that should be echoed throughout Canada. If we want mm-hmm. to have distraction, if we want to raise awareness, we must have common messages that is given trial.
Mm-hmm. I see. And what's exciting in the strategic plan for the Arthritis Society Quebec Division for the next year or two?
That's so wonderful. So the first essence of creating this national symposia series based on the Quebec model for the Congress, it is truly a great recognition of the heavy lifting that we have done over the past few years, but also to be able to better address advocacy, and that advocacy is now forefront of the strategy of the Arthritis Society. We have done our work on this side for so many years now, getting all the ecosystem together to be able to identify the need, find solution to close the gap, and then to create this momentum toward the official, to be supported by our national office, and to be able to leverage it even further is truly amazing for us, and we want to continue to that way.
That's excellent. And in terms of partnerships, I've been exposed to the Arthritis Alliance of Canada's work on the economic burden of arthritis to Canadians, etc. So I see the value in those partnerships, and I also see the value in the partnerships with the other professional organisations. What are the most exciting partnerships that you can think of at the moment moving forward over the next 12 months?
I think that yes, if we could leverage on the work of the Alliance, be able to work with the rheumatologists first and foremost, with other patient organizations, if we can come to a single voice and sing all the same song, that would be a tremendous win for us, and be able to say, you know what, it is a devastating disease. We have solution that we want to bring. This could help us, and that's the way that we would like the things to come. And if we are able to all come into a single place, single time, that would be wonderful.
Well, I think that's great. We're going to pause and just see if there's any questions from the audience.
Yes. Do you have any tips on how to write or talk to government officials to advocate for change?
Yes, as a matter of fact, I would invite everyone. We have a great section on our website, arthritis.ca, where you have this self-advocacy guide, and in part of it, there is also a place where you can find tips about how to write to your M&A. So please go visit our website.
And what are some of the challenges patients might face when they reach out to government?
First, I think that be heard is something that is truly hard at some point, because you have to go see them. You have to tell your own story for them to be able to understand what you are living. So to tell a great story, to identify short message, because they don't have a lot of time. So to be able to identify some short messages that you want, key points, then go ahead with it and say how can your M&As, your representative can change thing in their own environment, and what could be a greater ask for the minister. Must be short and concise and be able to bring it to a single message.
Yeah, and I think it's important for you to also, if you're advocating for anything, to provide the solutions.
Yeah.
Government doesn't want to just hear you belly aching about something, it wants to hear about the solutions as well. Any more questions? Well, Ken, that's great. Thank you for all your work for the arthritis community, and very nice to have you here this evening.
Thanks, Michael.
Good evening.
Thanks.